Let's talk about a question from yesterday. So the question says, a client with a history of prostate cancer is in the clinic and reports new onset of severe low back pain. What action by the nurse is most important? Okay, so this is a priority question because the last part of this sentence says most important. The very first thing that you should do anytime you see one of these types of questions is underline or highlight the key words in your question. Okay. Then the next thing that I want you to do is rewrite the questions. For instance, if I were to see this question, I see two key things that stand out to me: history of prostate cancer and severe low back pain. Okay. So I would reword the question something like this. What should the nurse do if she has a patient who has history of prostate cancer and it is now showing severe low back pain? Okay. And so therefore, I know that whatever option that I pick has to address not only the history of prostate cancer, but also the severe low back pain. Okay. So the very first thing we see is I look through my answer choices. It says to assess the client's gait and balance, ask the client about the ease of urine flow, document the report completely, or inquire about the client's job risk. Okay. NCLEX test 101, rarely is the answer document the report completely unless everything you're seeing is something that's normal. This patient just had new onset of severe low back pain. That's not normal. So we're not going to just document, right? It's like, okay, I know your back hurts. I know you had cancer in the past and now you have this all of a sudden crushing back pain. Let me just document it. Okay, I've done nothing. So right away, we can go ahead and cross that option off. So we're left with 3. So that's the next step. I want you to try to eliminate one that doesn't really answer or does not satisfy the question. Okay? The other one we can kind of take off is to inquire about the client's job risk. Okay? That does address possibly the severe low back pain. Maybe the patient has job risk, but notice one key thing that I said in that, maybe. Okay? If you have to say maybe, could be, should, typically you're headed down a rabbit hole and you're getting ready to send yourself in the wrong direction. Okay, so we can cross this one off as well because it can address the low back pain, but it doesn't address the history of the prostate cancer. The best answer here is assess the client's gait and balance. So let's talk about it. This patient right now is exhibiting signs and symptoms of spinal cord compression. This can be seen oftentimes with your patients with history or active prostate cancer. Okay? And so when you're looking at these priority questions, you always start off with your ABCs. And I'm pretty sure you had that drilled into you since day 1 of nursing school. Talk about airway, breathing, and circulation. But one thing that is often missing is that we say ABCs. There's a given that there's an S at the end, right? We also have to think about safety. Okay? That's one tip or skill that we have to think about as well. Anytime you see most important, we are thinking about priorities. So start off with your ABCs. Okay? The next thing we notice here is that we identified a problem. This question also follows the nursing process. So we identified a problem. So now we need to do some assessment to support this. Let's get some evidence. And the only one that kind of gives us some thorough assessment is A. Okay. So for safety, assessing the gait and balance is going to be your priority in this question. Stay tuned for the question of the day for today.